Officially, after getting married and then, actually trying to make a family was like in 2016 or 17. We started to try, and I just always had, like the miscarriages. And, I'm just thinking that at that time, I just had a miscarriage, there's nothing to it. But then once I kept getting pregnant and I kept having miscarriages, I was like, something is wrong with like me. And he referred me to Dr. Lewis. I went to him. He sent all my records to him. And once I had my appointment with Dr. Lewis, he went over everything, year by year. He was saying that I had like an infection or something, like the amniotic fluid. In some kind of way, my cervix just opened up, like by itself. And I remember him saying, okay, I know what we need to do. You need to have a cerclage.
So cervical cerclage is a suture that's placed in the cervix, usually between 12 to 14 weeks, to prevent the cervix from opening. Characteristically, it's the treatment of choice for patients with cervical insufficiency. That basically is a diagnosis where patients have, the characteristic description is a patient has painless cervical dilatation, usually in the second trimester.
The 10th week, well, maybe like the 8th week, he scheduled me for the cerclage. And week by week, I was like, oh my God, I'm 10 weeks. Oh my God. I was like, I'm 12 weeks. And I was just waiting for something to happen, really, because I'm so used to, me having miscarriages. So I was just waiting, and my family, husband, and everybody, they was encouraging me to like, oh, you never got this far, so, it's going to be okay. I made it all the way through until, because I had the cerclage and because I had high blood pressure, I had to get induced at 37 weeks. And by now, I'm like, oh my God. And 37 weeks, went to the hospital. It was just like, he took the cerclage out and then the process started. Out of all of these pregnancies, it was the 20th pregnancy. And she came, and that's why we named her Miracle. We named her Miracle Faith, because it definitely was a miracle, because out of all the pregnancies, all of the doctors, all of the specialists, nobody said what needed to be done. And Dr. Lewis said what needed to be done.
It's the most satisfying experience to know that you've helped a couple or an individual have a child, right? And that child becomes their family. And for a lot of patients, they've had difficulties maintaining their pregnancies, or they've lost pregnancies, or they've had babies born prematurely.
With this experience, I will put it out there to anybody. Dr. Lewis is the greatest. He never stopped until he get things done, and he just awesome. That's all I can say. He's awesome.
Oh, I can't wait to tell her the story. We got pictures of her. We take so many pictures of her. We got collages to show her how she was. We even saved the sonogram pictures. We cannot wait to tell her why her name is Miracle. With Dr. Lewis being my doctor, I probably would. If I end up pregnant again, of course, I'm gonna go through the same process. Gotta get a referral, and my referral will be to Dr. Lewis, for sure.
My message to her is she should try and get pregnant again. I mean, little Miracle probably needs a little brother or sister, and I'd be happy to put another cerclage in her and have the same outcome that we had in the prior pregnancy.